bar that you see quantifies the difference between lifespan and health span. Lifespan, of course, is how long we live. And health span describes for how long we are healthy. And in the United States, as these numbers imply, there's a big difference between the two. Most of us, the vast majority of Americans, are unhealthy for some substantial portion of their life, and then they die. And that doesn't have to be so. There are lots of people, not here, but there are lots of people who are healthy for almost as long as they live. And that's something we really ought to aspire to and can attain. And I'm going to talk about that in my next talk. This graph describes three scenarios. One is where there's no intervention, no medical intervention. You just live your life in the United States, and you can see, as that first line shows, your health declines starting about halfway through your life, and it continues to decline until you die. The second scenario, labeled Med 2.0, that dotted line right next to the solid line, that describes what happens when you encounter people like me, physicians. And what do we do? For the various problems that you accumulate and gather in your life, we prescribe procedures or prescription medications to treat them for whatever it is: hypertension, overweight, diabetes, COPD, asthma, cancer, autoimmune disease, whatever the problem is, we prescribe medication. And as you can see, this graph is implying it doesn't do much to extend your health span. But at the very end of your life, when you're doing your worst, we can really noticeably extend your lifespan. At that point, you need diuretics for congestive heart failure and maybe oxygen and various other interventions to prolong your life right when you are at your sickest and feeling most unwell. And we prolong that lifespan for you until finally, exhausted and fed up, you die. And what do we physicians say at that point, after that long experience that we've traveled together? We say, okay, we did everything we could. But that is not true at all. As that third line implies, that second dashed line labeled Med 3.0, there is a better way that you and I can work together and you and I can live so that we are healthy far, far longer than we otherwise would be, and than we are normally under normal medical care in the United States. The difference between those two lines, Med 2.0 and Med 3.0, is what I'm interested in. And there are several things that account for that difference that we all can do. Among those are live with purpose, meaning just do something that you think is important every day. And I would add to that, I think, just with respect to that first thing, do something difficult every day. Challenge yourself in some way, whether with exercise or some instrument you're practicing or something you're reading, something you're thinking about. Do something difficult every day. 2, stay connected to people. 3, sleep 7 hours. 4, don't smoke. 5, little to no alcohol. And 6 and 7, eat healthy food and exercise every day. Now, these are not new ideas at all, as you know. We all know these things are good for us. And I've focused in the last few years with you folks on item 6, eating healthy food, because I think that gets a little bit complicated, and deciding what food is healthy and how much you need of certain types of food. I've talked about protein, and you know my argument about food. We should all eat a lot more plants than we do. Don't worry about protein. That can get a little bit interesting, but basically this is common sense stuff. And so that begs the question, if these interventions are so effective and valuable, why are so few people doing them? And very few people are doing them. 95% of American adults are fiber deficient. That means not that we're not getting enough Metamucil or Colace or Senecot or Miralax. We're not eating enough plants, because plants are the only foods that have fiber. 95% of Americans don't exercise a half hour or more a day, every day, 7 days a week. You can't get 95% of Americans to agree on anything. 20% of Americans think Africa is one big country instead of a continent. So it's really impressive how few of us are doing these things that we know are so valuable in extending the duration of our health span. And I've wondered why that is. And I think there are a few reasons for it. One is, I think to some extent, people don't know just how effective these things are. And I talked about food, and in my next talk that I'll give in the spring, and I'll keep you posted about this, I'm going to talk about how effective exercise is. It is unbelievably effective. Exercising every day does more to preserve your health and ward off disease than quitting smoking does. That's how powerful exercise is. I think part of the reason that we don't do these things more than we ought to is people like me don't talk about it. You know, you go to see the doctor, and maybe at the end of the visit, your doctor says, "Oh, yeah, and by the way, eat healthy food and exercise. Good luck with that. See you next fall." We didn't receive any training on these interventions in med school at all. I went to the University of Vermont. It was a great med school. I had 0 hours of nutrition instruction and 0 hours of the benefit of exercise. It just wasn't brought up because we had two major things to focus on, as all med schools do: diagnosing disease and treating it with drugs. That's really what our training is all about. And that training is useful, but it really overlooks some fundamentally valuable things that you and I ought to be much more focused on. So that's what my next talk is going to be about. I've talked to you folks about food and how useful I think that is. Eating healthy food and making 2/3 of lunch and dinner at least vegetables, legumes, nuts, and seeds, at least that much for those 2 meals. The more the better. Don't worry about getting protein. And next time I want to talk to you about exercise. I've been reading about that, and it is just extraordinary how powerful exercise is in prolonging our health span, extending that. And that is really an attainable goal. That's something we can do. So I look forward to talking to you about that. And I think, you know, just in closing, John Candy's onto something here. The truth is, exercise is more effective, as I said, than quitting smoking and avoiding alcohol and just about any other intervention you can think of. It's just amazing how effective it is. So we'll talk more about that, and I'll keep you posted. It's February 1 as I record this video. I'll be giving a talk at Riverwoods in Exeter later this month. I'll give you details about that. And later this year in the spring, I want to give this talk about exercise and go into more depth about how we can extend our health span together. Thanks for watching. Talk to you soon.